Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Are you tired of being tired? Are you ready to look for new and natural solutions to your health problems? Give us a call and set up your free 30-minute consultation to see how we can help you today. Call 281-710-3380 or visit balancedbodyfunctionalmed.com. I'd like to introduce my guest today, Dr. Julia Ward, who's an MD, and she's a champion for healthcare for busy and stressed out mums. Her own issues with hormone imbalance and chronic fatigue spurred her to complete a study of functional medicine. Thank you for joining us today, Julia.
Thank you for having me.
So first of all, what made you decide you wanted to be a doctor?
I actually thought I was going to be a veterinarian. When I was growing up, I loved animals to the point where I felt like I just related to animals way better than humans. But unfortunately, when I was 11, my father was suddenly diagnosed with liver cancer, and he passed away within about 3 months of the diagnosis. And that just kind of changed my perspective. So I looked into going into human medicine. So that's kind of how I got into medicine to begin with.
Mm-hmm. Oh, and where did you study?
So I went to University of Southern California for medical school, and I had the Navy pay for it. It was a kind of a Navy scholarship thing where they would pay for my medical school because it's a private school, so it was a little expensive. And then in turn, I would work for the Navy. Mm-hmm. So I ended up doing my internship in OBGYN with the Navy at the Naval Hospital San Diego, actually. And then at that time, the Navy, once you finish your internship, you would be kind of useful to them because you get your license, and they would put you out in the field. So I got stationed with the Marines, actually an artillery unit up in north of San Diego. And I was with them for a year, and then I decided to apply to an anesthesia program instead of the OBGYN, because during my internship of OBGYN, I realized that I don't do well with sleep deprivation, which seemed to be a lot of that residency. Mm-hmm. So I went into anesthesia, and when I entered anesthesia, I was actually pregnant for the first time. So I entered this residency pregnant, and I ended up resigning from it when I was 6 months pregnant with my second child. And I just have to say, I never really knew that I would be so maternal. I never really babysat that much. I was never interested in other people's kids and babies growing up. But boy, when I had my own, it just maternal instinct hit me like a brick wall. And all I wanted to do was stay home and be with these babies. Mm-hmm. So it really kind of was life-changing, and I ended up resigning from that residency, which was taking up, just a ton of time. It was very demanding time-wise. Mm-hmm. And so I started doing primary care, and that's what I did up until about 6-7 years ago now we have 5 kids, and so it takes a lot of time. There was never any one point where I felt like I could go back to do a residency program because the kids were always, they need you. Mm-hmm. And when you're in a residency, you're kind of surrendering your time to somebody else. So I found functional medicine, and it was primarily because I was feeling so run down at this point. And I was working out. I was working out to compete in bodybuilding, and I had a job, but I was feeling worn out. I would be falling asleep driving to work in the morning, and I was sleeping at night. I was just feeling worn out, and I wasn't taking any vitamins or supplements. Somehow I came across, I was looking into bioidentical hormones. I'd kind of heard of them, but never really learned much about them, because it is not something that is taught in medical school or residency or internship, anything. So I researched it myself, and that's how I discovered functional medicine. And to me, it just made sense. I'm like, well, why aren't they teaching this in medical school? This makes way more sense than just the reactionary kind of traditional teaching that we get. So that's kind of how I got into it.
And how long ago was that?
Oh, let's see. So I've been practicing medicine for over 25 years now. I found the functional medicine thing about 6-7 years ago. Yeah.
So do you have your own practice, or do you work with someone? You own
No,
your
I
own.
have my own practice that I started a little over 4 years ago now, and it's been great. I really enjoy it.
And when did you first hear about LDN?
I was trying to remember. It might have been from a compounding pharmacist that I know, and he's been through a lot of the same functional medicine training that I have. So I use him quite a bit, and I think he may have mentioned it first. And in fact, it was one of the pharmacy that he owns, they had a copy of the LDN book that they gave me. And that's really when I started reading it and looking more into it. And now I've got quite a few patients on LDN, because so many people have autoimmune disorders or inflammation in general. And in fact, throughout my adult life, I've suffered from anxiety, depression, and I just recently read that LDN can help with that condition, because it's sort of an inflammation of the brain. So I've been taking LDN myself now for the past, I want to say, 4 months or so. And so far, it's been great. I feel definitely better on the LDN than I did off of it.
Well, that's good. And it's still early days. 4 months is...
Yeah. And I also combine it with CBD oil, just because there's been some research showing that the CBD and the LDN kind of potentiate each other. They make each other better rather than just by themselves. So yeah, I have a ton of patients that I prescribe that to.
Okay. So what would you say the conditions are of the patients that you're prescribing LDN for?
So definitely like Hashimoto's, thyroiditis, rheumatoid arthritis. I don't have that many lupus or Crohn's or ulcerative colitis, but a few. Multiple sclerosis, fibromyalgia, definitely, any chronic pain, celiac, psoriasis, scleroderma. Those are like kind of the main ones. So, yeah.
Well, you said chronic pain there. Do you use the ultra low dose if some of the patients who are experiencing pain are already on an opioid? What do you do?
That's difficult, and I admit I don't have a lot of patients who are chronic pain. So when I start patients on it, usually they're not on an opioid. If they are on an opioid, we're trying to wean them off and definitely start them on an ultra low dose.
Okay. And what about cancer? Do you have any cancer patients?
Yes, I do. In fact, I have one patient who was just recently diagnosed with cancer, with breast cancer, and she came in just wanting to get tuned up as far as her nutrition goes. We can't do anything hormonally for her because of the nature of her cancer. But I did talk to her about getting on LDN, and she cleared it with her oncologist, and so she just started taking that. But yeah, there's a lot of great anti-cancer properties to that as well. So, absolutely.
Okay. So what dosing regime do you use?
I typically start people on a 1 milligram capsule and then work them up to a 4.5, usually over the course of about 4 weeks or so. Some people tend to be more sensitive to it than others. People do okay with that kind of building up slowly regimen. And we've got a good compounding pharmacy nearby here, too, that does like a 3-month supply for only $78. So it's a good deal.
Wow, it's very good.
Yeah.
So Do any of your patients ever report any negative side effects?
I had one patient tell me that it made her really sleepy and that she couldn't get above 0.5 milligram because it just made her groggy the rest of the day.
Mm-hmm.
She's the only one that has said anything as far as a negative side effect. Most people are fine with it. I tell people sometimes people can experience some vivid dreams in the beginning, but those usually go away after your body gets used to it.
Mm-hmm. Have you noticed that some patients can't get to 4.5?
Yes, once in a while we have a patient who they were feeling good on like a 2.0, and then when they went above that, they started having issues of either sleep or headaches or something, and so we just back it back to the 2.0 because I think it's still better to be on some, even if it's not up to that, 4.5 dose.
I mean, there are some people that report that on 2 milligrams it works perfectly. They have very good results.
Yeah.
But because they read on the internet that you should be aiming for 4.5, they think...
I think you really have to judge how your body reacts to it.
Exactly. Yes.
Yeah. You can't just be a one-size-fits-all.
No.
That's why that's the whole basis of functional medicine is really to make it individualized for you.
Mm-hmm.
So,
yeah.
Absolutely. Yeah.
I mean, because some people are just disappointed. It makes me ill every time I go higher. So why don't you stay on the dose?
They don't need to go higher.
Exactly,
yeah.
yes.
Yeah.
I mean, the internet's a wonderful thing.
Yes.
But
sometimes it's too much information.
It is, isn't it? Yes, definitely.
Yeah. Absolutely.
Okay. So what age range of patients do you get?
So the majority of my patients are, 40 plus, but I do have some younger patients. I've had as young as 12, and I have some older teens, young 20s, for one reason or another. And I don't know if there's an age cutoff, if they don't recommend it for younger patients. That my 12-year-old that was in our program had a Hashimoto's, and I did want her to try the LDN, but her mom was just not convinced, so that didn't happen.
I mean, LDN is used in fertility clinics to get patients pregnant, and they generally stay on the LDN all the way through pregnancy, breastfeeding.
So it's super safe then, because if you could give it to pregnant women, it is like safer than Tylenol.
Exactly.
Yeah.
So that's really good, but there haven't been the trials and the studies. But Dr. Phil Boyler's treated hundreds of ladies with pregnancy who use LDN.
Right, which is unfortunate because it seems like to do these, medical studies like the official ones that cost thousands and millions of dollars, you have to go through certain committees, and I can see that, pregnancy is a very tricky thing. There's very few studies that they allow to be done prospectively. Retrospective, that's fine, but the prospective studies using placebo, double-blind, controlled, randomized trials, it's a tricky thing.
I mean, what comes to mind is the thalidomide? Is that the right one? Yes. I mean, that was awful, wasn't it? Absolutely terrible. Was that back in the 70s?
Yeah, 60s or 70s. Yep. And that's really where the U.S. FDA kind of got their reputation, because at the time they held off. And so the U.S. didn't have the birth defects that the U.K. did.
Okay.
And so that's where the U.S. FDA got a really great reputation as being kind of this, watchdog for anything that comes across. It might be a little sketchy. But, it's a double-edged sword. Sometimes if they're too restrictive, we don't get medication that is available to other people. So
it always amazes me. You advertise your drugs on television. We don't do that here.
Right.
But it does make me laugh because you have these drugs and it says it could cause
Yeah,
a heart
everything.
attack. It could cause renal failure.
Yes,
It could cause, and then at the
yes,
end it says, and possibly death. And I'm thinking,
yes, exactly.
why would anybody, having read that, want to take this drug?
Exactly. Yeah, it's because we have too many lawyers in our country.
Mm. Yeah, it just
So,
amazes me that anybody ever takes anything.
right. Yeah,
And
exactly.
these drug companies must be paying for these adverts, you know.
Yes, they are. Uh-huh.
Um, mm, uh,
Yeah. Yeah, you get kind of at the tail end of that commercial, this auctioneer's voice that goes through the litany of side effects or possible bad outcomes.
I know.
I think maybe people are just immune to it now. They're just like, yeah, they say that for everything. I don't
Mm,
know.
could be. I mean, we have in our medications a leaflet which gives you all the details. I
Yeah,
wonder how many
right.
people actually read those leaflets.
Mm. Yeah, probably not many.
No,
No.
they're there for you to read, and then it's optional, isn't it, whether you actually read them or
Yeah,
not?
exactly.
Mm,
Exactly. Well, you just, it's like most, you have to trust what your doctor is recommending
exactly.
because that's what they studied and you figured they have, the answer and
Hmm.
they've looked at the options. So, yeah.
Yeah. I mean, have you treated anybody with mental health issues with LDN?
Yes, a lot of my anxiety depression patients, I will suggest the LDN for them as well.
Hmm.
Um, and we've had good results. I also do some low-dose IV ketamine treatments, which also helps with treatment-resistant anxiety and depression. That's been really helpful. But definitely the LDN is a great, another tool in my tool bag to help with that.
Hmm. I mean, with the post-traumatic stress syndrome,
Yes, that
I
too.
was years ago. I thought, oh, that must be for veterans, military
Hmm.
people. But of course, it's all sorts of people can
Yeah.
suffer with that, especially rape victims.
Hmm.
And it
Yeah.
seems to really work, which is
Hmm.
good.
It is.
Yeah, and it's not one of those drugs that you would see on American television with all these
No.
horrendous side effects.
Right. Because it is what we call an off-label use. It's, it's not approved by the FDA to treat all these symptoms, and especially not at the dosage that they're talking, which is why it has to be compounded. It's not going to be available as a commercial kind of prescription. It has to come from a compounding pharmacy so that we can make it in these smaller doses and vary it. So like you were saying, some people can't take more than 2.0 milligrams. Other people need to get up to a 4.5. But that's where the compounding pharmacies come in. And that kind of, because our medical system here in the U.S. is so controlled by the big pharmaceuticals and by the insurance companies, and the big pharmaceuticals are not going to make billions of dollars off of something like low-dose Naltrexone because it's generic and it's compounded. So you're never going to see a commercial for low-dose Naltrexone.
Exactly.
Yeah, yeah.
What about skin conditions? Have you any experience with that?
Well, when we treat skin conditions, it's usually a byproduct of the GI system being in disarray somehow, some kind of gut dysbiosis is what we call it. They either have some degree of leaky gut, maybe they have like food allergy or sensitivity, or they've got, straight out like irritable bowel, Crohn's, something like that. So when we heal the gut, generally the skin gets better.
Well, that's amazing.
Yeah.
So,
And most people don't
sorry.
realize things like rheumatoid arthritis kind of start with the leaky gut. That's, when the leaky gut starts, and I don't know if you discuss leaky gut or not on your show,
We have.
but
Yes.
okay, so you understand the GI system is lined by a single cell layer thick of epithelial cells, and inflammation causes these gaps in between those cells so that what we swallow can go directly into the bloodstream. And then the body reacts and starts forming antibodies towards those foreign particles, but eventually our body starts attacking our own cells. And so that can be the thyroid, or that can be the joints, resulting in these autoimmune diseases.
Mm.
Yeah.
I mean, there is so much you can do to improve your health, which a lot of traditionally trained doctors haven't been taught, with diet and supplements and different lifestyle changes.
Yeah. Yeah, and there's a couple reasons. I mean, number one, functional medicine is not really taught in medical school, residency, or internship. And number two, the traditional doctor here in the U.S. operating under insurance systems, like a typical primary care doctor, is allotted 10 to 15 minutes to see a patient. And that's really not time enough to find out what's going on and teaching them how to modify lifestyles or diet. Or even supplements. As an MD, you're not given any training in supplements during your training. It's something that you have to kind of go out and learn on your own.
So when a patient first comes to see you, what are the steps you take to lead them onto the path of good health?
So first we sit down and we just have a conversation about what's going on with their health, what their main concerns are, and what's happened in the past. And then we will start with comprehensive blood work. We do a much more detailed hormone panel, thyroid panel, and cardiometabolic panel than most traditional doctors do. We also like to look at genetics because genetics do play a factor in what health issues you may be dealing with. And I love that test because it's just a cheek swab, so it's super easy to do. And we also have like a body composition scale here, a bioimpedance scale that measures how much fat, muscle, and water and where it's all located. So that gives us a good starting point. And then we have comprehensive programs lasting, either 3, 6, or even sometimes less time frame, depending on the state of health that you come to us in. And the comprehensive program really kind of guides you through a bunch of, first a detoxification, and then some lifestyle changes, kind of like teaching you how to eat healthy, just different from what most people normally do, but not difficult, just different. We have a nutritionist that we work with, and she really personalizes the program for each individual patient. And then we're, during this time, we're also balancing hormones, balancing the thyroid, making sure that everything looks where it should be.
Do you take insurance?
So insurance, I tell people, insurance is there to keep you alive. It's not there to keep you healthy. It's very reactionary. So it's going to pay for medications, for surgeries, for hospital stays, but the damage has to be done already. It's sort of like you want to redecorate your house, and so you wait for it to burn down so you can use the fire insurance. It's the damage has been done. Nobody really goes about redecorating their house that way because that would be silly. So, but our insurance system is set up so that it's very reactionary. Like you have to get diabetes before they pay for diabetic medication. Well, now you're in diabetes. There's a lot of damage that has been done because of that condition just being there in the first place. So we typically can use people's insurance to run blood work, but the type of preventative programs and lifestyle modification programs that we have, insurance is not set up to pay for that.
Okay.
Yeah.
So what would you say mainly you tell your patients? There must be a protocol that fits most people, even though it's tailor-made individually. What would you say the main points are?
The main points is you want to eat clean food, organic if possible, drink clean water, breathe clean air. Those are like the main things. So we want to eat as much whole, clean, unprocessed foods as possible. I tend to think that gluten and dairy are very inflammatory type of foods, and they will cause leaky gut to some degree. Not everybody I mean, the majority of people, they will be causing some inflammation, maybe not severe in some people, but there's always some degree. And so we try to steer people away from foods like that and into, alternate things that they can eat and still feel satisfied and like they're not being deprived.
Mm-hmm. And I must say, since I've been gluten-free, I don't know how many years it was, but when I first started, most gluten-free food tasted quite horrible. It wasn't very palatable. But as time has gone on, you can get some really tasty gluten-free meals now that we've got some bread in England, which I've had for a few months now, and it tastes, to me, it probably doesn't taste anything like the bread I used to eat, but it is really acceptable and I enjoy it.
That's awesome.
Well, it is, isn't it? I mean, years ago,
Yeah.
the bread that I bought, I tried so many different brands and I tried to make myself eat it and then I just threw it away because it was horrible. But there are more.
Yeah, there's definitely far more products available now. And I think, too, if you kind of alter your eating habits, for a while you're going to miss the old way. But then eventually you start feeling so much better being grain-free or gluten-free or dairy-free or whatever, that you don't want to go back to the old way, because and frequently people will tell me this. They say, oh, I slipped up after a month of sticking to the program. I went and had a hamburger, and then I had a stomach ache a couple hours later that just went on and on. So there's your answer.
Yes.
This is why you shouldn't go back to it.
But it does make you the guest from hell, though, when you go to somebody's house and you're very limited as to what you can eat.
Yeah.
I have to laugh. I've just organised a conference in the Bahamas and I ordered lunch for everybody, and I said that half of the people were dairy-free, gluten-free, some of them were vegetarian, some were vegan.
Yeah.
And everybody had to be accommodated for, and everything had to be labelled.
Yes.
So it arrived and we were late breaking up, and the only thing that was gluten-free was the fresh fruit salad. I couldn't believe it. And I said...
Well, it doesn't surprise me in a place like the Bahamas where selection is somewhat limited because they're in an island,
But
and they're probably not used to cooking like that.
In the shops, though, the supermarkets, I have never seen such a vast array of gluten-free products ever.
Yeah.
I mean, in England, you get like half an aisle, but they would have 2 aisles, and it's like, wow, I have never seen so much gluten-free food. Really, really funny.
Yeah.
Oh, what
it depends where you are. Like in here in Texas, if you go to Austin, most restaurants have gluten-free sections if they're not totally gluten-free at all. And then veganism is the same thing. I'm certain areas are going to be easier than others to find food that's healthy as far as that goes.
We travelled somewhere, I can't remember where we were going, and I was wanting a snack because we hadn't got time to stop for a meal. And I went in a supermarket and I walked around, couldn't find the gluten-free, or they call it a free from here, aisle. So I asked somebody and she said, oh, we tried it, it didn't work, it wasn't popular, and we did away with it. And I thought, really? Wow.
Yeah.
Okay.
Again, it's probably pretty regional as to where you are in the country.
Probably.
Yeah, because like I said, Austin, you probably can't get away from it, but certainly in the more kind of rural areas where they're used to traditional standard American diet, you're not going to find it so much.
But you can't go wrong if you buy your fresh food and cook it yourself and you know what's gone in it, because if you start buying anything, really...
Anything pre-made.
Exactly. And if you look on the label, there is gluten there somewhere. It's very hard to find anything that is gluten-free. In actual fact, we've run out of time. It's been amazing speaking to you, Julia.
Thank you so much. It's been really fun.
And thank you for having been my guest today. And we'll have to have you back another time.
Well, I appreciate it so much. Thank you.
Thank you. Are you tired of being tired? Are you ready to look for new and natural solutions to your health problems? Give us a call and set up your free 30-minute consultation to see how we can help you today. Call 281 710 3380 or visit balancedbodyfunctionalmed.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.